Hello, Marcus Boston. Quick video today, and I'm going to speak with you really quick because I'm at my little local diner. I'm getting to get some food, but I want to talk with you about umbilical cord gas scoring, or pH, and HIE, or hypoxic ischemic encephalopathy. Now, hopefully within the next couple of days or next weeks or so, I'm able to get into a lot more depth on this subject on our other website, HIE Resource Place. But suffice it to say, I want to talk with you about this today because it is important, especially from a medical legal standpoint. So what is this cord gas, or this pH? What are we talking about with this? Well, according to the agency ACOG, in that literature, if you have an umbilical cord score, you got a gas reading of lower than 7.1, if that pH score is lower than 7.1, then at that particular point, they are saying that acidosis or some type of event, oxygen-related event, has occurred. If you got a score that's greater than that, the 7.1 or greater, up until maybe a 7.38 or so, that's supposed to be around in the normal range. And if you are, it's their position that you cannot have fetal neurologic injury. It does not occur without significant metabolic acidemia. And so what they're saying is that that score lower than 7.1, then that's where you're in that range. And so now there are other issues that do come into place, especially from a medical legal standpoint, when we are analyzing and looking at the records, like for example, intrauterine resuscitation measures, what did the fetal heart strip show? Like, there are other things that we have to take into consideration, but that umbilical cord gas, that pH reading, that is important also. So I just want to talk with you today about that number, because maybe you have, your doctors have talked to you about that, and you've heard these, this pH thing, and you've heard that, and you're wondering what it is. So I just wanted to talk with you today and give you some information on that. So if you have more questions on this issue, maybe you're here because your baby has suffered an HIE injury, you've got an HIE diagnosis, you've got a low cord gas or pH score, you have questions, or maybe you now have an HIE diagnosis and a subsequent CP or cerebral palsy diagnosis, and you've got questions. What I invite you to do is pick up the phone and call me. There's a telephone number on the screen. It costs you absolutely nothing to talk with me about your baby story. It costs you nothing to do that. What I invite you to do is, when you talk to the secretary, just let them know that you would like to be put on the calendar to talk. We have a block of time to talk about your baby story. One more thing, I practice law here in the state of Maryland, and I know this video is on the internet and on social media sites and stuff, and so if you contact me or you reach out to me and you are not in Maryland, just understand that we have to use co-counsel or local counsel. In other words, an attorney in your state, and that's something that we can work with you on, but I just want to make sure that you understand that co-counsel or that local counsel aspect of things if you are not in the state of Maryland. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law here in the state of Maryland at Boston Law Group, LLC. And we'll talk with you next time. Take care and enjoy the rest of your day.